I have the honor and privilege to introduce Ms. Anne-Marie Nitschke. She is the director at the Ministry of Health and Social Services in Namibia, particularly in the Directorate Special Programs. Ms. Anne-Marie Nitschke has vast experience in the design and management of directed policy development, strategic planning, resource mobilization, and coordination. She leads a program aimed at creating an enabling environment for people infected and affected by HIV to ensure they enjoy a Over to you, Anne-Marie.
Good afternoon, everyone. And yeah, thank you for the opportunity to share a little bit of the Namibian program. Next slide. Yeah, this slide, if you can see the dates that is indicating, it might come to your mind that why would I share an old slide like this? But this is basically the last year that Namibia has conducted the sentinel surveillance. And we also wanted to just confirm that this slide indicates, where exactly in the country do we have the highest prevalence rate. And after all these years, during the NAMFIA that we have conducted recently, it basically confirms that it still remains the same. Next slide. Yeah, this is slide indicates that as a country that we have all committed to the 90 targets, and Namibia has been able to actually stick to the targets that we have set. NAMFIA has confirmed again the program data, and yes, we also had some challenges over the last few months with COVID-19 and all the challenges that came with it. But we are convinced that we are still doing extremely well despite the circumstances. Next slide. Yeah, in terms of the achievements that we want to briefly share was that we have revised our guidelines last year, and we have agreed as a country that we will transition to TLD. And yes, again, we had some challenges because the moment that we started, it was COVID-19. But yes, we have still managed to have 66.3% of the patients on first-line ART already transitioned to TLD, based on the regimen, like I said, that we have in place after the revision of our guidelines. In terms of PMTCT, we can say that over 98%, which is ranging between 84 and 100% of women who delivered knew their status, and those found to be positive, over 90% of them were already on ART treatment at the time of delivery. So we still continue to decentralize the ART services, and we have gone a little bit faster with COVID-19 in terms of decongesting the facilities and really decentralize to the community level. Next slide. Yeah, in terms of testing, the implementation of the targeted high impact and evidence-based testing approaches that we have introduced, like self-testing and index partner testing, of course, also were a little bit slowed down during the COVID-19 challenge that we had, because we had to relook at our strategies and still continue with recency testing and other, but at a very lower scale than initially planned and envisaged. But yes, we still very much committed to same day initiation and also to ensure that there's immediate linkage to care. So we have constantly re-evaluated the national program during COVID, and where there was real challenges, we have really tried to scale up during, especially like the pediatric HRT optimization, the point of care viral load testing in some regions. And yes, we can confidently say that 347 health facilities are providing ART treatment, care, and support. The next slide. Yeah, in terms of stigma and discrimination, we can say that yes, as a country, our constitution definitely ensure in Article 10 that there is non-discrimination on the basis of sex, race, color, ethnic origin, religion, creed, or social or economic status. Yes, Namibia have also signed to the International Covenant on Economic, Social and Cultural Rights, and we definitely recognizes that the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. The National Health Act of 2015 is currently under revision, and also the Namibian Patient Charter in the Public Service Charter expands further on the responsibilities of the state or government in relation to the health issues. Then we also, in our national strategic framework that we have actually ends in 2020, we have also prioritized human rights based approaches to all vulnerable and marginalized groups, including women, men who have sex with men, transgender women, and sex workers. But it's worth mentioning that, yes, despite the fact that we may have some legal instruments in place that guides the way we handle stigma and discrimination in the country, we are not at the place that we want to be. Next slide. Yeah, this is supposed to give us a bit of demonstration about some of the factors that contributes to stigma and discrimination. But like I said previously, we have already included it in our national strategic framework. And as a ministry, we take into account that not all groups receive the same level of services and enjoy the same level of freedom. So groups that currently faces health inequities include, but definitely are not limited to rural communities, especially the adolescent girls and young women, the LGBT communities, the sex workers, the migrant communities, and the persons with disabilities, as well as the people living with HIV. So in our annual revision of programs and plans, we are looking at these specific groups that are being mistreated, and we definitely make sure that as we plan for the next year, that we address those issues that are within our jurisdiction, to make sure that we definitely have specific programs to address the needs of these different groups. Next slide. I'm sorry if I'm rushing, but I think I only have 5 minutes. Yeah, this is basically what is in the National Strategic Framework. So if you can see the diagram indicates that we have taken care of the cross-cutting social and programmatic enablers, but we have also in country a combination prevention strategy that we have developed, which tries at least to address the contributing factors through the promotion of a human rights, community-centered HIV prevention approach. So we also recognizes that yes, there is mix of structural, biomedical, and behavioral responses to meet the unique needs of the communities. And that's why I say one need to appreciate what is in place. But I've also followed during Linda's presentation, and that's why I've requested for the presentation, because I already picked up that there are a number of issues that one can actually adapt in our own circumstances and see how we could address the needs of the certain population groups in country. Last slide. Yeah, in terms of best practices, like I said, we have ensured that there's a comprehensive prevention service package, including PrEP, and we have recently actually revised that service package with WHO and other partners in country. We also, we have tried to ensure that there's always condoms available. We have scaled up tremendously the medical male circumcision program in country, as well as the cervical cancer screening and treating program. We also have invested a lot of time and resources into NIMART throughout the country. And there's been an increased focus on identifying the most vulnerable age and sex segments, like the out-of-school rural adolescent girls, remote, poor mobile males with money. Yes, we are protecting the adolescent girls and young women by implementing DREAMS program, together with the adolescent girls and young women's program that are currently supported by Global Fund. So there has been a number of strategies and interventions to see how we could address the stigma and discrimination issues amongst the different groups. The last slide, I thought this one was the last one, but I think there's one left. Next slide.
This is your last slide, Anna Marie.
Is this the last slide? Okay, maybe I've already cut the other one. But the thing that I still wanted to mention was just that we have also experienced that the timely linkage to care of the newly diagnosed people living with HIV and the same day initiation, like I previously mentioned, have really also resulted in very positive results for the HIV program. We have a number of very good practices in terms of teen clubs and community adherence clubs and a lot of groups, which indicates that the HIV program needs to be mentored for you to have successful results. I thank you.